Hello students, welcome to today's session that is regarding a simple discussion on the beta adrenergic receptors. So what is the location and function of the beta adrenergic receptors? Okay, so I hope you know beta adrenergic receptors are comes under sympathetic nervous system. There are three types of beta adrenergic receptors like beta 1, beta 2 as well as beta 3. So all these are comes under the G protein coupled receptors. All these are comes under the G protein coupled receptors. Just a minute, we will go forward. Okay, here the first one is regarding beta 1 receptors. So regarding signal transduction. So what is signal transduction? A signal transduction is like a switch on or off mechanism. So if a beta 1 receptor have to stimulate, it switch on the receptor. If beta 1 receptor shut down, it switch off the mechanism. So signal transduction is like a switch on or switch off mechanism. That switch on or off is based on the binding of a ligand. If agonist will bind, it shows the agonistic action. If antagonist bind, it shows the antagonistic action. So the signal transduction will decide the pharmacological action. If it want to increase the heart rate, means it have to promote the signal transduction. If it want to reduce the heart rate, it have to shut down the signal transduction. So here the signal transduction of beta 1 receptors is G alpha S. G alpha S. So regarding what is G alpha S, what is G alpha Q, what is G alpha IR naught, what is G alpha 12/13, that is clearly we discussed in the receptor pharmacology. You can go to our previous videos, receptor pharmacology, nothing but receptors. So here G alpha is one of the active G protein we can generally for our understanding purpose called as G alpha S means stimulation. When G alpha S is activated due to stimulation of beta 1 receptor, there is an increased AC, adenyl cyclase action. This increased adenyl cyclase increase the cyclic KMP levels. When cyclic KMP levels are increased on the heart, it produces cardiac muscle contraction. So what is the location of heart? Sorry, location of beta 1 receptor, that is heart. So when heart is bind by the adrenaline on the beta 1 receptor, there is a positive inotropic action and positive chronotropic action, positive dromotropic action. Positive inotropic means number of contractions are increased. Positive inotropic means number of contractions increases. Positive chronotropic means number of beats increases. Chrono means sound related to beats. And the positive dromotropic means the conduction velocity increases. So positive inotropic contractions increases, positive chronotropic number of beats increases, positive dromotropic the conduction velocity of myocardium increases. So because of this all positive effects, there is an increased cardiac output as well as there is an increased blood pressure also. So excess increased sympathetic activity may lead to hypertension. So this is regarding general description of the beta 1 receptors. Next one is beta 2 receptors. Next one is beta 2 receptors. So the signal transduction of beta 2 receptors is G alpha S, active G protein, and here also adenyl cyclase as well as cyclic AMP. Adenyl cyclase action increases, but here there is an increased cyclic AMP levels. But the difference, so in case of both beta 1, beta 2 receptor, same signal transduction, but in case of heart muscle there is a contraction, but here there is a relaxation. Here there is a relaxation. Why here relaxation means the cyclic AMP, the cyclic adenosine monophosphate is a secondary messenger on the lungs, it produces relaxation. So especially the location of beta 2 receptors is on the lungs, bronchial smooth muscle. The cyclic AMP on the bronchial smooth muscle causes relaxation. And apart from this beta 2 receptors are also present in the GIT, uterus. So both GIT as well as uterus, both are smooth muscle. On the smooth muscle, the cyclic AMP causes relaxation. And apart from that, the beta 2 receptors also present on the mast cells. When beta 2 receptors present on the mast cells agonized, what will happen? There is a inhibition of histamine release. There is a inhibition of histamine release. This is regarding the beta 2 receptors. So unintentionally I forgot here, the beta 1 receptors are also present on the kidney, especially JG cells, juxtaglomerular cells. Okay, when beta 1 receptors present on the kidney activated, it increases the renin release. When renin release increase, it leads to activation of renin angiotensin aldosterone system. Next, beta 3 receptors. Next is beta 3 receptors. So even beta 3 receptors are also same signal transduction, G alpha S, adenyl cyclase as well as cyclic AMP. So again, I'm repeating, if you want to understand what are the signal transductions, what are this G alpha S and G potents like that, please go through our video on receptor pharmacology, nothing but receptors. So the location of beta 3 receptors, urinary bladder. On the urinary bladder, so urinary bladder is also a smooth muscle. Again, the increased cyclic AMP on the smooth muscle causes relaxation of the bladder. So urinary bladder is a smooth muscle. It causes relaxation. And apart from that, the beta 3 receptors are also present on the adipose tissue. Adipose tissue. So what is the function of beta 3 receptors on adipose tissue? If beta 3 receptors are stimulated by the cyclic AMP on the adipose tissue, there is a lipolysis, breakdown of the fats, and helps in the thermogenesis, production of the heat. So here simply, so the description regarding beta receptor. So what are different types? What is their signal transduction? What is the location? And what is the function? So you have to compulsory understand the receptor pharmacology, their location, their signal transduction, their function. Why? If you understand their location and function, when you have to use antagonist and agonist, you can clearly understand. For example, if heart rate is decreases, if heart rate or heart action is decreases, then you have to give the agonist. If heart rate is more severe, leads to hypertension, then you have to give the antagonist. So what I'm telling, so you have to clearly understand what is the receptor, what is its location, what is its function, to know how agonist is acting on that receptor, antagonist on acting on that receptor. And based on that agonist, antagonist, you can understand where agonist will be useful and where antagonist will be useful regarding clinical applications. So this is regarding a simple description of beta receptors, that is sympathetic nervous system adrenergic receptors, beta receptors. Okay, thank you.